Welcome to the Deep Dive. Today we're tackling a really important health topic for our dogs and cats, proteinuria. We've got it's a stack of source material right here. Articles, research, clinical notes, all focusing on this one condition.
Yep.
And our mission today is basically to dive into these sources, pull out what's most crucial for you. What is it? Why does it even happen? What does it actually mean for a pet's health?
Right.
And critically, how do the experts diagnose and manage it, according to this information we have?
Exactly. Think of us as guides through this specific pile of material. Because, proteinuria can sound pretty simple, just protein in the urine.
Yeah.
But these sources, they reveal a much, much deeper story. So we're going to try and extract those core insights, synthesize the key knowledge, and really help you understand what's most important about this condition based purely on the data provided here.
Okay, let's get right into it then. Based on our sources, what is proteinuria at its most basic level?
Yeah.
How are they defining it?
Well, the sources lay out a few ways it's identified. At its simplest, it's detecting urinary protein. Often the first step is just a standard dipstick test.
Okay.
But for a more, let's say, concrete definition, especially when we're thinking about potential kidney issues, they talk about specific quantitative measures.
Right, the numbers.
Exactly. The most common one mentioned is the urine protein not creatinine ratio, or UPC.
Real easy, got it.
And a UPC of 0.4 or greater in cats, or 0.5 or greater in dogs, that's generally considered significant protein loss.
Okay.
They also mention a borderline range, 0.2 to 0.4 in cats and 0.2 to 0.5 in dogs. Something to watch.
So kind of a gray area.
Sort of. And other measures mentioned are the urinary albumin-creatinine ratio, UAC. They're usually looking for values over 30 milligrams per gram there, or even measuring total protein in a full 24-hour urine collection.
It sounds like a hassle.
It is, which is why UPC is preferred. But for the 24-hour test, more than 20 milligrams per kilogram is considered abnormal, according to these sources.
Got it. So it's definitely more nuanced than just a simple yes or no on that dipstick. There are thresholds?
Precisely.
What about this term microalbuminuria? That sounds like maybe a smaller version or an earlier sign.
Exactly. The sources highlight microalbuminuria as detecting low concentrations of albumin in the urine. Specifically, they mention the range of 1 to 30 milligrams per deciliter.
Okay.
And the really critical point here is that this level is actually below the detection limit of those standard urine dipsticks.
So you'd miss it with a basic test.
You would. You need special, more sensitive tests to find it. It's seen as a potential early warning signal.
Fascinating. Okay, so we know what it is and how it's measured. But why? Why does protein, which isn't supposed to be there, end up in the urine? Our sources seem to break this down.
They do, and understanding the why is really fundamental because it points to where the problem lies in the body. Think of the urinary system, maybe like a complex plumbing network.
Right.
With a really sophisticated filter that's the kidney's glomerulus.
Right, the filter.
So the sources describe basically 4 main scenarios where protein leaks through this system. First is pre-renal.
Pre-renal.
Yeah. This isn't actually a problem with the kidney filter itself. It's more of an overload situation.
Right.
There's just too much of certain small proteins circulating in the blood, maybe from excessive red blood cell breakdown or significant muscle damage.
Right.
And the filters just get overwhelmed. They physically can't reabsorb all of it.
Too much coming at them.
Exactly. Then second, and this is often the one with the most significant long-term health implications according to these sources, is renal glomerular proteinuria.
Glomerular. So that is the filter.
That is the filter problem. The glomerul, those tiny filtering units are damaged. They lose what the sources call their perm selectivity.
Yeah.
Basically, they can't selectively keep the larger proteins like albumin in the bloodstream anymore.
So the filter's got bigger holes, essentially.
You could think of it that way, yeah.
Yeah.
It's letting things through that it shouldn't. Third is renal, tubular. Here, the main filter, the glomerulus, might have worked okay, but the pipes after the filter, the kidney tubules, aren't doing their job properly. They fail to reabsorb the smaller proteins that normally do pass through the filter but are then reclaimed.
So a failure in the cleanup crew stage.
Kind of, yeah. The tubules aren't reabsorbing like they should. And finally, there's post-renal.
Post-renal. After the kidney.
Exactly. This is protein getting into the urine after it's already left the kidneys. So somewhere in the lower urinary tract, the bladder, the urethra, places like that. Usually this happens because of bleeding or inflammation in those areas. Blood or plasma just leaks into the urine stream.
That plumbing analogy really does help. Different points of failure along the path.
It clarifies where the issue might be originating.
Now here's where, for me, reading these sources, it got really interesting. Proteinuria isn't just a localized kidney or bladder thing. It can actually ripple outwards and affect other body systems. What systems get involved, and how does that work?
Yeah, this is a really key insight the sources emphasize. Persistent proteinuria, especially that glomerular type we talked about.
The leaky filter one.
Right. That can trigger a whole cascade of problems elsewhere in the body.
Okay.
Obviously, the renal urologic system itself is directly hit. The ongoing protein loss, plus the underlying damage to the glomeruli, can progressively harm the kidney tubules too. This just accelerates the development and worsening of chronic kidney disease, CKD.
Makes sense. The kidney's taking a double hit.
It is. Then the sources also strongly link it to the cardiovascular system. They note that systemic hypertension, so high blood pressure, is very frequently seen along with glomerular disease. They seem to go hand in hand often.
Okay, kidneys and blood pressure, a known link.
A very strong link. And then, perhaps less obviously, the hemilymphatic immune system gets involved. Severe glomerular proteinuria can lead to complications like edema.
Swelling?
Yeah, swelling, often noticeable in the legs or belly, and also something called hypercoagulability.
Hypercoagulability, that sounds bad. Like increased blood clotting.
That's exactly what it is. It's a tendency to form blood clots more easily.
Why does that happen?
Well, the sources explain that when you're losing lots of protein in the urine, you're disrupting this delicate balance of substances in the blood that normally control clotting. You lose some of the key proteins that prevent clots, like antithrombin.
Ah, you lose the brake.
You lose some brakes, yeah. And at the same time, other factors that promote clotting might increase or become more active. So this imbalance, it significantly raises the risk of dangerous blood clots forming, potentially in the lungs, which is called pulmonary thromboembolism.
Wow.
And the edema, the swelling. That happens partly because you're losing albumin. Albumin is a major protein that helps keep fluid inside the blood vessels, maintaining oncotic pressure.
Okay.
Less albumin means fluid is more likely to leak out into the tissues. Plus, the sources say the kidneys also start inappropriately retaining sodium, which makes the fluid retention worse.
Wow. Okay, so finding protein in the urine could genuinely be a clue to a process that might lead to serious things like blood clots or significant swelling.
Yeah.
That's a much bigger deal than I initially thought.
It really elevates the significance, doesn't it? It's not just an isolated finding on a urine test strip.
Not at all.
So maybe let's shift gears slightly and look at who's most at risk. And how common is this, according to the information we have?
Good idea. What do the numbers in these sources tell us about prevalence? How often are vets actually detecting this?
Well, there are a few studies cited here that give us some perspective. One study looked at urinalysis data from about 500 dogs and found approximately 19% had proteinuria, nearly 1 in 5.
19%.
And then when you look specifically at microalbuminuria, remember that early low-level signal we talked about?
The one the dipstick misses.
Exactly. The detection rate there is even higher. Large studies mentioned here found it in around 25% of dogs and also about 25% of cats screened.
A quarter of them. Wow.
Yeah. And a really crucial point the sources make across the board is that the prevalence seems to increase as animals get older.
That makes intuitive sense, I suppose.
Mm-hmm.
Things wear out. Are there certain types of animals more prone? You mentioned dogs and cats, but any age groups or specific breeds, maybe?
Yeah, the sources consistently state this is a more commonly recognized issue in dogs compared to cats.
Okay.
And while it technically can occur at any age, the type of proteinuria often correlates with age. Those familial inherited kidney diseases tend to cause glomerular proteinuria in younger animals.
Right, the genetic ones.
Whereas the acquired forms, the ones that develop later due to other issues, are more typical in middle-aged or older pets.
Okay. And breeds. Did the sources list any?
They did. While again, many breeds can be affected, the sources list quite a few with known familial nephropathies, kidney diseases that are associated with glomerular proteinuria. Some examples that jumped out were Samoyeds, English Cocker Spaniels, Bull Terriers, Bernese Mountain Dogs, Dalmatians, Brittany Spaniels, Sharpies, Dobermans, the list goes on.
A fair few, then.
Quite a list. They do add a caveat, though, that for many of these breed dispositions, the specific genetic cause or exact mode of inheritance hasn't actually been pinned down yet. It's more of an observed association.
Understood. So if an animal does have proteinuria, what might someone actually notice? What are the signs, the clinical signs, or physical findings a pet owner or even a vet might pick up on?
This is a tricky area because, as the sources really emphasize, the signs vary a lot. It depends heavily on the underlying cause and just how severe the protein loss is.
Okay.
And here's a critical takeaway from these materials. Animals with glomerular proteinuria, even quite severe forms, are often asymptomatic, especially early on.
No signs at all.
Often no obvious signs that the owner would notice. The signs you do see might actually be related to the underlying disease that's causing the proteinuria rather than the protein loss itself.
Ah, okay, so signs of infection or cancer or whatever the trigger is.
Exactly. But if signs are present related to the proteinuria or its consequences, the sources list things like weight loss, maybe lethargy, just generally being
Vague signs.
very vague often. Now, if a serious complication occurs, like one of those blood clots going to the lungs,
The pulmonary thromboembolism.
right, then you might see sudden acute difficulty breathing. That's an emergency. And if the proteinuria is actually originating from lower down, like a bladder infection causing post-renal proteinuria,
Right.
then you'd expect to see those more typical urinary signs: straining to urinate, going more often, having accidents, maybe visible blood in the urine.
Okay, that makes sense.
Yeah.
What about on a physical exam? What might a vet find?
Well, if it might detect that swelling, the edema we talked about, particularly in the limbs or under the belly, maybe even some fluid buildup in the abdomen causing distension.
Mm-hmm.
If the kidney disease is advanced and the animal's becoming uremic, meaning waste products are building up, they might find things like ulcers in the mouth. And they might pick up subtle clues like changes in pulse quality that could hint at thromboembolic complications.
Gotcha. So often silent, but the signs can range from subtle to dramatic, depending on the cause and complications.
Precisely.
Which brings us back squarely to those underlying issues. We categorized the types of proteinuria earlier: pre-renal, renal, post-renal. But what about the specific diseases or conditions the sources mention that actually cause each type? Let's dig into those lists.
Right, this is getting into the diagnostic weeds, the potential culprits. Let's break it down by type again, based on the source lists.
Okay.
For pre-renal proteinuria, remember, that's the overload issue, not faulty kidneys.
Too much protein delivered.
Exactly. The sources mention conditions that cause large amounts of small proteins to flood the bloodstream, overwhelming the kidney's reabsorptive capacity. Key examples given are severe hemolysis, that's red blood cell breakdown, or rhabdomyolysis, which is major muscle damage. Also, certain cancers, particularly multiple myeloma, which can produce huge quantities of abnormal proteins, sometimes called paraproteins or Bence-Jones proteins.
Right, those specific abnormal proteins.
Yep. Then under renal, there's a category called functional proteinuria, mentioned briefly. The sources list things like really strenuous exercise, high fever, possibly seizures, or even severe venous congestion. But importantly, they state these causes are actually poorly documented in pets as consistent triggers for clinically significant proteinuria, so maybe less common or less clear-cut.
Good to know. So let's focus on those. What about the main renal categories?
Right. The big one under renal is glomerular disease. This is where the sources list various ways the kidney filter itself gets damaged. They talk about different forms of glomerulonephritis, which is basically inflammation of the glomeruli.
Pharmitis, meaning inflammation.
Exactly. And also glomerulonephropathy, which refers more to non-inflammatory damage. Specific conditions listed include things like membranoproliferative glomerulonephritis, membranous nephropathy, minimal change disease, hereditary forms like hereditary nephritis, and amyloidosis, that's abnormal protein deposition in the filter. Also things like focal segmental glomerulosclerosis and just general glomerulosclerosis or scarring.
Lots of complex names there.
It is a complex area. A key insight the sources offer here is that pretty much any significant glomerular damage can cause severe proteinuria. But they suggest that the immune complex mediated forms like those membranoproliferative and membranous types might cause the highest magnitude protein loss.
Okay, so some types might leak more protein than others?
That seems to be the implication. Then there's renal tubular proteinuria. The cause here is damage or dysfunction of the kidney tubules themselves, the reabsorbing pipes. This prevents them from reclaiming proteins they should. This typically results in only mild to moderate protein loss, according to the sources, compared to the potentially massive loss with glomerular disease.
Got it. Less dramatic leakage.
Generally, yes. And finally, post-renal. As we said, this is pretty straightforward. Any condition causing significant bleeding or inflammation in the lower urinary tract bladder infections, stones, tumors, trauma down there, can leak protein into the urine after it's left the kidney.
Okay, that covers a huge range of possibilities.
Yep.
And the sources also mention factors that don't directly cause it, but sort of
Yeah,
increase the risk of developing some of those main glomerular diseases, right?
absolutely. That's a really important connection made in the material. Glomerulonephritis and amyloidosis, those key glomerular problems often don't just happen in a vacuum. They can be triggered or exacerbated by other ongoing issues in the body.
Okay, what kind of issues?
A major category of risk factors highlighted are chronic inflammatory or infectious diseases. The sources give a pretty long list of examples here.
Like,
Things like heartworm disease, various tick-borne diseases, Ehrlichia, Lyme disease, Babesia, chronic bacterial infections anywhere in the body, like endocarditis, which is infection of the heart valves, or even chronic skin infections, pyoderma, also pyometra, which is a uterine infection,
wow, okay.
even things like Bartonellosis, feline immunodeficiency virus, FIV in cats.
So lots of different chronic infections.
Definitely. Chronic cancers are also listed as potential triggers or risk factors, as are underlying immune-mediated diseases, with systemic lupus erythematosus given as an example.
Makes sense. The immune system attacking the kidneys.
Potentially, yes. Or chronic inflammation associated with cancer stimulating the kidneys inappropriately. Other systemic conditions mentioned as increasing risk include chronic hypertension, high blood pressure itself is a risk factor for kidney damage, and also chronic hyperlipidemia.
High blood fats.
Right, high cholesterol or triglycerides. The sources even specifically call out miniature schnauzers as a breed where hyperlipidemia is a known risk factor potentially leading to kidney issues, including proteinuria.
Interesting specific example.
It is. And one more link, multiple myeloma, that cancer we mentioned earlier, produces those paraproteins, which can directly cause Bence-Jones proteinuria, a specific type of pre-renal or renal issue.
That really drives home the point that finding proteinuria can just be the tip of the iceberg, potentially pointing to a significant underlying systemic health problem.
It absolutely can be. It prompts a wider search.
So with all these possibilities, how do vets actually figure out what's going on? If proteinuria is present, what type it is, and what might be causing it? What's the diagnostic roadmap laid out in these sources?
Yeah, the sources describe the diagnostic process as a logical, stepwise approach. The main goal is to differentiate between those categories: pre-renal, post-renal, renal tubular, and especially figuring out if it's glomerular, because that often carries the most serious implications.
Okay, where do they start?
It typically starts with those initial screening tests, the urine dipstick, and sometimes the sulfosalicylic acid test, or SSA. These give a quick qualitative or semi-quantitative result, like a yes, no, or a little lot.
Right, the first alert.
Exactly. But the sources really emphasize that you have to interpret these results with significant caution.
Why is that? What are the limitations?
Well, several things. Their accuracy is very dependent on how concentrated the urine is. A trace positive might be normal in really concentrated urine, but significant in dilute urine.
Okay.
Plus, they have specificity and sensitivity issues. One source quoted dipstick specificity as low as 69% in dogs and 31% in cats, meaning lots of false positives.
31%. That's really low.
It is, and sensitivity wasn't great either. False positives can happen with certain disinfectants, highly alkaline urine, or even just leaving the dipstick in too long. And critically, dipsticks might completely miss certain proteins, like those Bence-Jones proteins from myeloma or other gamma globulins.
Okay, so definitely not foolproof.
Yeah.
What about the SSA test?
SSA has its own issues. False positives can occur with things like radiographic contrast agents or certain antibiotics. False negatives can happen in very alkaline urine, and results can be skewed if the urine isn't centrifuged properly.
So limitations all around on those initial tests.
Definitely. Which is why the sources strongly recommend the next step if protein is detected. Always examine the urine sediment under a microscope.
Looking for
Red blood cells, hematuria, white blood cells, pyuria, or bacteria. This is crucial for helping to rule out a post-renal cause, basically. Is there evidence of bleeding or inflammation or infection in the lower urinary tract that could explain the protein?
Makes sense.
Interestingly, the sources note that even if there is evidence of inflammation, like pyuria, it often doesn't cause really high-magnitude proteinuria on its own. One study mentioned showed most dogs with pyuria still had negligible albumin levels and normal UPC ratios. So infection alone might not explain really significant protein loss.
Okay, so sediment check is key. What next?
If the screening test is positive but the sediment looks clean, or if there is evidence of lower tract inflammation that's been treated, the sources advise repeating the protein test maybe in a few weeks.
To see if it's persistent.
Exactly, because transient proteinuria could just be functional, related to stress or fever, or maybe it was just a false positive on that first test. You want to confirm it's a consistent finding.
Okay. And if it is persistent and doesn't seem to be just from the lower tract?
Then the next crucial step is quantification, measuring how much protein is being lost. And the preferred method highlighted in the sources is the UPC ratio.
Back to the UPC.
Back to the UPC. It's considered much more reliable than dipsticks for confirming the presence and tracking the magnitude of protein loss over time. The 24-hour collection is accurate but impractical, so UPC is the go-to. UAC is another option.
What about microalbuminuria testing here?
The sources position microalbuminuria testing as a valuable early screening tool, perhaps even before overt proteinuria shows up on dipsticks or UPC. If microalbuminuria is detected, the recommendation is to repeat it in 2 to 4 weeks. If it's consistently positive, or especially if the concentration is increasing over time, the sources suggest this indicates the pet is at significant risk for developing overt glomerular disease later.
Like an early warning system.
Exactly. And here's another diagnostic clue the sources mention. If you find significant proteinuria along with low blood albumin levels, that's hypoalbuminemia,
Right.
that combination strongly suggests the protein loss is glomerular in origin because that's the filter that's supposed to keep albumin in. Though they caution, not all animals with glomerular disease will have low albumin, especially not early on.
Got it. So if it looks like persistent, significant, possibly glomerular proteinuria, what's the overall goal then?
The sources really stress that at this point, a thorough diagnostic workup is essential to search for those potential underlying diseases we discussed, the infections, inflammations, cancers, etc.
The root causes.
Exactly. This usually involves comprehensive blood work, checking for markers of inflammation, specific infectious disease testing based on history and location, and assessing overall organ function.
What about imaging?
Imaging, yes. Abdominal ultrasound and possibly radiographs are mentioned as important tools. They can help identify underlying infectious processes, inflammatory conditions, or tumors that might be driving the proteinuria. They can also show structural changes in the kidneys themselves, like loss of normal architecture, changes in echogenicity, or an irregular surface, which might suggest chronic disease or specific conditions like amyloidosis.
Okay. Any other key diagnostic procedures?
Blood pressure monitoring is highlighted as crucial given that strong link between renal proteinuria and systemic hypertension. You need to know if high blood pressure is part of the picture.
Right.
And finally, the sources present renal biopsy, taking a small tissue sample from the kidney as the definitive tool for getting a specific diagnosis of the type of glomerular disease present. This is particularly indicated when a thorough search doesn't reveal an underlying systemic cause, or if proteinuria persists for months despite treating a suspected underlying cause.
Why do the biopsy?
Because knowing the exact type of glomerular damage, is it immune-mediated? Amyloidosis, scarring, can sometimes significantly influence the specific management and prognostic outlook according to these sources.
Okay, that sounds like a really thorough, logical process to narrow things down from a simple positive test to potentially a specific kidney diagnosis.
It's designed to be systematic, yes.
So let's say that detective work is done. A diagnosis, or at least a strong suspicion of the type and cause, is reached. How do the sources say proteinuria is actually managed or treated?
Right, management. It's definitely tailored to the specific cause and the severity of the situation. For most patients, the sources indicate management happens on an outpatient basis.
Okay.
Inpatient care might be needed for certain diagnostic procedures, like the biopsy, or if significant complications arise, like severe uremia requiring fluid therapy, or managing acute thromboembolism or severe edema.
What about things like activity?
Interestingly, the sources suggest that for patients with glomerular disease causing hypoalbuminemia and edema, physical therapy and mild exercise might actually help limit the swelling. They advise avoiding strict cage confinement in those cases. But generally, activity doesn't need to be restricted otherwise.
And diet. You mentioned that earlier.
Diet is presented as a cornerstone, particularly if glomerular disease is suspected or confirmed. The strong recommendation in these sources is to transition the pet onto a kidney-specific therapeutic diet. These diets are typically modified in protein, phosphorus, and sodium, and often supplemented with things like omega-3 fatty acids.
Okay, kidney diet is key.
Seems to be, yes. Client education is also highlighted as vital.
Makes sense.
Yeah, explaining the importance of finding the cause, the potential long-term risks like progressive CKD, clots, swelling, and really emphasizing the need for sticking to the recommended treatment and monitoring plan.
What about surgery? Any considerations there?
The main surgical consideration mentioned relates to anesthesia risk in animals with severe hypoalbuminemia, very low blood albumin, say less than 2 grams per deciliter. This can affect drug binding and fluid balance, potentially making anesthesia riskier and possibly requiring referral to a specialist center if surgery is needed for another reason.
Good point. Okay, let's talk medications. This seems like a primary part of the management strategy in the sources.
It definitely is,
Yeah.
especially for significant renal proteinuria and particularly for glomerular proteinuria. The sources clearly identify angiotensin-converting enzyme inhibitors, ACE inhibitors, or ACEI as the first choice therapy in both dogs and cats.
ACE inhibitors like enalapril or benazepril.
Exactly, those are common examples. These drugs work by targeting a hormonal system called the renin-angiotensin-aldosterone system, or RAS.
Okay.
Inhibiting the system helps lower pressure within the glomeruli, which reduces the amount of protein being forced through the damaged filter. It also has beneficial effects on systemic blood pressure.
So tackling the pressure aspect.
Primarily, yes. Now, if an ACE inhibitor alone isn't effective enough at reducing the UPC, or if the pet experiences adverse effects, the sources suggest the next step is often adding or potentially switching to an angiotensin receptor blocker, or ARB.
ARBs, like telmisartan.
Telmisartan's the main one mentioned for veterinary use, yes. ARBs target the same RAS pathway but at a different point, blocking the receptor for angiotensin II. Sometimes using both an ACEI and an ARB together provides better RAS blockade and protein reduction, though requires careful monitoring.
Okay, ACI first, maybe add or switch to an ARB. What else?
Well, aldosterone antagonists are mentioned, but the sources say they need more investigation. They might be considered if aldosterone levels remain high despite ACEI or ARB therapy.
What about the high blood pressure itself?
Right, concurrent hypertension is common, as we said. Often, the ACEI or ARB alone isn't enough to control the blood pressure adequately. In those cases, the sources state that adding a calcium channel blocker like amlodipine is frequently necessary. Sometimes even other classes of antihypertensives might be needed in complex cases.
So often multi-drug therapy for blood pressure.
Very often, yes. The sources also mention nutritional supplements, specifically N3 polyunsaturated fatty acids, PUFAs, the omega-3s often found in fish oil.
Omega-3s.
Yeah. They suggest these should be considered if the pet's diet, even the kidney diet, doesn't have an appropriate ratio of N6 to N3 fatty acids, aiming for around 5.1. They're thought to have anti-inflammatory effects that might be beneficial, especially noted for dogs, possibly cats too.
Okay. And what about the clotting risk?
Ah, yes, the hypercoagulability. For dogs with diagnosed glomerular disease, the sources recommend implementing a thromboprophylaxis, basically, measures to help prevent clot formation. The two main options discussed are low-dose aspirin or clopidogrel.
Aspirin or clopidogrel for clot prevention in dogs.
In dogs with glomerular disease, yes. The sources also add some general precautions. Be aware that drugs highly bound to albumin might have altered effects or increased toxicity if albumin levels are very low. They specifically advise avoiding warfarin, a potent anticoagulant, and using high doses of diuretics like furosemide to manage severe edema needs caution, especially if the pet is also azotemic or severely hypoalbuminemic.
Lots to consider there with medications. Okay, so treatment has started, maybe an ACEI, maybe blood pressure meds, diet change, omega-3s, clot prevention. How do you keep track of how things are going? How do the sources say you monitor these patients?
Monitoring is absolutely crucial, according to these sources. It's essential not just to see if the treatment is working to reduce proteinuria, but also to track the progression of the underlying kidney disease and watch for potential side effects of medications.
Not often.
For patients being actively treated for glomerular disease, the recommendation is for monitoring at least quarterly, so every 3 months or so.
Okay. And what gets checked at these visits?
The core monitoring panel includes repeating the UPC ratio to quantify the protein loss, doing a full urinalysis, checking systemic arterial blood pressure, and running blood tests to measure serum albumin, serum creatinine, which reflects kidney filtration function, and serum potassium levels.
Why potassium?
Because the drugs that block the RAS system, the ACE inhibitors and ARBs, can sometimes cause potassium levels to increase, which can be dangerous if it gets too high, so that needs watching.
Got it. So how do you judge if the treatment is actually working? based on these tests?
The UPC ratio is the primary tool used to assess the response to anti-proteinuric therapy. The sources state that the ideal target is to reduce the UPC to below the threshold for proteinuria. So less than 0.5 in dogs or less than 0.4 in cats. Some sources might say 0.2 for cats as ideal without causing a significant decline in kidney function, i.e. a rise in creatinine.
The ideal goal, what if that's not achievable?
If that ideal target can't be reached, the alternate therapeutic goal mentioned is to achieve at least a 50% reduction in the UPC from the baseline value. So cutting the protein loss in half is considered a positive response.
Okay, 50% reduction is the backup goal.
Yes. But here's a really important point the sources make. You must evaluate the UPC trend alongside the serum creatinine level.
Why is that?
Because imagine a scenario where the UPC goes down significantly, which looks good, but at the same time the serum creatinine level goes up sharply. That might actually mean the underlying kidney function is worsening, perhaps due to the disease progressing, or maybe even an adverse effect of the medication reducing filtration too much. So reduced proteinuria isn't necessarily a win if the kidneys are failing faster.
Okay. You need both pieces of the puzzle. Context matters.
Absolutely. The sources also acknowledge that UPC values can fluctuate quite a bit from day to day or even sample to sample.
Right. Biological variation.
Exactly. So they suggest that sometimes making treatment decisions based on a single UPC might be misleading. It might require looking at the trend over 2-5 serial assessments or potentially using a pooled urine sample where the owner collects small amounts from 2-3 separate voids over maybe 48 hours, refrigerates them, and mixes them together to get a better average value.
Interesting technique, the pooled sample.
Yeah, it aims to smooth out some of that daily variation. And specific to monitoring during ACE inhibitor or ARB therapy, the sources provide some guidelines. For dogs in early CKD stages, stage 1 or 2, a creatinine increase of up to 30% after starting the drug might be considered acceptable as long as it stabilizes.
Okay.
But you want to avoid any significant worsening of renal function in dogs already in stage 3 or 4 CKD, and you need to monitor potassium to ensure it stays below a certain level, HoriT 6 mL, and that systolic blood pressure doesn't drop too low, Hg stays 120 mmHg.
So careful balancing act, especially with those RAAS blockers.
Very much so. It requires regular checks and adjustments.
Okay, that's a clear picture of monitoring. Finally, let's talk about the big picture stuff based on the sources. Can proteinuria actually be prevented? And what's the general outlook, the prognosis, once it's diagnosed?
Prevention, in the sense of stopping it from ever happening, is difficult because the underlying causes are so varied. Infections, immune issues, genetics, aging.
Right.
But the sources strongly advocate for strategies aimed at early detection, which is the next best thing. The main recommendation here is for annual urinalysis, specifically including protein assessment, for all adult dogs and cats as part of routine wellness care.
Annual screening.
Yes. And if protein is detected on a screening test, the advice is to repeat it in 2 to 4 weeks to confirm persistence. If it is persistent or if microalbuminuria is found, then the sources stress the importance of that thorough diagnostic investigation we talked about to identify any underlying or predisposing causes.
Find the trigger.
Find and, if possible, eliminate or manage the trigger. That's crucial. If proteinuria persists despite managing an identified cause, or if no underlying cause can be found, and the pet is in early or moderate stages of CKD, stage 1, 2, or maybe 3. That's when the sources indicate considering a renal biopsy is most valuable. Getting that specific diagnosis can then guide the most appropriate long-term management plan to slow progression.
Okay, so proactive screening and aggressive workup of persistent cases.
That seems to be the key preventative strategy highlighted. Now, for prognosis, the expected course and outcome, the sources are very clear. It depends almost entirely on the cause of the proteinuria.
Makes sense.
Proteinuria due to temporary pre-renal issues, like severe dehydration that's corrected, or easily treatable post-renal problems, like a simple bladder infection that clears up. That proteinuria should resolve completely once the inciting cause is gone. The prognosis is tied to the underlying issue.
Okay, what about the renal types?
Renal tubular proteinuria is often associated with underlying kidney diseases that are inherently progressive, so the prognosis might be more guarded depending on the specific tubular disease.
And the big one, glomerular.
Glomerular diseases, according to these sources, are also generally considered progressive conditions. The rate of progression, however, can vary hugely between individuals and different types of glomerular disease. The sources mention that rare cases of spontaneous remission have been reported, but that's definitely not the norm.
So, usually progressive.
Usually. Persistent glomerular proteinuria often leads down that path of ongoing tubular damage, eventually resulting in advanced CKD, uremia, the buildup of toxins, and unfortunately, death. Survival times are incredibly variable. Some animals might decline rapidly within months, while others might live reasonably well for years with appropriate management.
What factors might suggest a poorer prognosis?
The sources indicate that the presence of nephrotic syndrome, that combination of heavy proteinuria, low albumin, high cholesterol, and edema fusion, generally points to more severe disease and potentially shorter survival. Also, the presence of azotemia, elevated creatinine and BUN, at the time of diagnosis usually signifies more advanced kidney damage and correlates with more guarded prognosis.
Understood. So highly variable, but often a progressive condition if it's glomerular.
That's the general picture painted by these sources, yes.
Well, we've certainly navigated a complex topic here, diving deep into what proteinuria is, the surprising number of ways it can happen, its quite significant systemic effects, and how the experts, based on these sources, approach the detective work of diagnosis and the complexities of management. It is definitely more than just protein in the urine.
Absolutely. I think the sources collectively paint a picture of proteinuria not just as a finding, but as a potentially significant clinical marker. Often it's acting like a red flag, pointing towards deeper underlying issues, particularly kidney damage, but also potentially systemic inflammatory, infectious, or neoplastic diseases. Understanding the specific type and cause is just paramount for effective management and for having any idea about the likely prognosis.
Thinking about everything we've unpacked from this stack of information today, what single idea or piece of data really stands out to you? What's maybe the most provocative thought here?
That's a good question. I think for me, considering how frequently microalbuminuria was detected in those large screening studies, around 25% in apparently healthy older dogs and cats.
Right, that high number.
Yeah. And knowing that the sources clearly identify it as an early predictor, potentially showing up before more significant damage occurs, it really makes you wonder, doesn't it? How could incorporating routine screening specifically for microalbuminuria, maybe as part of standard senior wellness checks, potentially shift our entire timeline? Could we detect kidney disease risk much earlier and intervene sooner in these aging pets? It feels like a really significant preventative question that emerges directly from the data presented here.
That is a thought-provoking question, moving from just finding overt disease to proactively screening for early risk markers. Definitely something to consider. Thanks for joining us for this deep dive into proteinuria.